Hi, I'm Julie Taylor. Today I'd like to talk to you about healthcare quality improvement and how coordination of care is key to quality improvement. Quality is a difficult and important question in healthcare. Quality improvement's aims have been defined as better patient outcomes, better system performance, and better professional development. Successful coordination of care can accomplish all three of these aims. Health professionals don't practice coordination well because in the past, when payment was solely based on fee-for-service, physicians did not have to coordinate. In a fee-for-service model, physicians and hospitals get paid the same fee regardless of the quality of care they provide. This model can incentivize physicians to order unnecessary tests and actually creates disincentives for quality. Now quality is at the center of healthcare reform. Care coordination has been identified by the Institute of Medicine as a key strategy that has the potential to improve the effectiveness, safety, and efficiency of American healthcare. In addition, the National Quality Forum identified care coordination as one of 6 national priorities in 2010 to expand patient-centered affordable healthcare. The Agency for Healthcare Research and Quality, or AHRQ, developed a definition for care coordination. Care coordination is the deliberate organization of patient care activities between 2 or more participants and sharing information among all the participants to achieve safer and more effective care. The main goal of care coordination is to deliver high-quality, high-value healthcare. Care coordination can improve outcomes for patients, providers, and payers. The AHRQ has developed mechanisms for achieving care coordination. The 5 broad approaches to achieve care coordination are teamwork, the healthcare home, care management, medication management, and health IT-enabled coordination. Some other specific coordination activities include communication, assessing patient needs, and supporting self-management goals. One of the 5 broad approaches is teamwork. Coordinated care often relies on team-based care where physicians share responsibility with nurses, care coordinators, patient educators, social workers, behavioral health specialists, and pharmacists. It might require restructuring of the healthcare system because resources need to be shifted away from the hospitals and towards case managers. Another one of the 5 broad approaches to care coordination is the healthcare home. A healthcare home is an umbrella term for medical homes and primary care homes. Healthcare homes are first contact primary care providers that are responsible for assuring patient care is comprehensive, continuous, and coordinated throughout the health system. Coordinating care means coordinating inpatient services with outpatient services, rehab services, and home health services. Healthcare homes have received increased attention as a way to coordinate care and maximize patients' health outcomes. The role of the physician is reframed to that of a personal physician or navigator for the patients. One of the purposes of coordinated care is to reduce unnecessary hospitalizations and urgent care visits. People without healthcare homes or primary care providers are at risk for poor health outcomes. In order to encourage healthcare organizations to focus on better patient outcomes and quality, healthcare payment is moving towards an outcomes and performance-based model. New payment contracts might reward providers for reducing the need for inpatient admissions and for reducing overall costs. They might also include payments for care coordination and care management outside of face-to-face visits with patients. Coordination of care can lead to high value. One measure of value is the outcomes divided by the long-term costs. If outcomes are achieved with reasonable costs, those healthcare outcomes will be of high value and high quality. But we need to be careful that financial incentives are improving the provision of care and not just improving documentation, which has been termed gaming behavior. The Patient-Centered Medical Home, or PCMH, is one model for coordinated primary care. The model promises to deliver high-quality, coordinated care that is patient-centered. In addition to providing acute care and managing chronic diseases, a PCMH might also offer home support services for patients with advanced and complex diseases. For example, the Lehigh Valley Health Network reduced hospitalization and overall costs by 40% in high-risk patients by using nurse managers, palliative care specialists, and social support personnel. The PCMH model also focuses on patient engagement. Patients are no longer viewed as passive recipients of information. Rather, they are active, prepared, and knowledgeable participants in their care. There's also a focus on improving patient-clinician communication. Health information technology, or health IT, is a critical factor in care coordination. Electronic medical records, or EMRs, could improve quality of care, efficiency, and health outcomes if they were interoperable. In a study within Kaiser Permanente in Northern California, interoperable EMRs were shown to improve patient care coordination, but fully integrating inpatient and outpatient records remains a challenge. In a model of coordinated care, providers have to keep tabs on the health status and utilization of thousands of patients. In order to track patients throughout the healthcare system, EMRs need to be used effectively and in conjunction with other intel sources. For example, hospital billing records and insurance records might be linked to inpatient-outpatient records. Community health clinics and social records could also provide useful data. A successful health IT system would also create real-time clinical alerts, help assemble case management lists, and be used to perform predictive risk modeling. Predictive analytics use historical data to predict future events and risks. It is prudent to use IT to predict which patients are at highest risk so that preventative interventions can be put into place early. IT should also be used to evaluate outcomes and success. This includes readmission management and preventive care management. Health IT should have tools to identify gaps and variations in care and the effects on outcomes. IT and analytics should be used to support continuous improvement and should be used for quality improvement projects. Convenient care clinics are one barrier to successful coordination of care. In a study, they found many patients don't allow their information to be shared after a visit to a convenient care clinic. One way to help break this barrier is for all healthcare providers to educate patients about the importance of care coordination. They also found that when information is shared, it's shared by facsimile, and the receipt of the information is never confirmed. The negative consequences of not completely or not accurately sharing information are severe. Patient safety can be jeopardized during transitions if there is poor information exchange. Other negative consequences include higher costs, misuse of medications, and misuse of tests, which lead to poor clinical outcomes. Patients with chronic diseases and disabilities are most vulnerable to poor care coordination. Government support is helping quality improvement. The Obama administration put $19 billion towards the implementation of health IT systems. Medicare is also playing a role. Beginning January 2015, Medicare will reward physicians $42 per patient per month to coordinate the care of patients with 2 or more chronic diseases. Medicare is also encouraging the use of EMRs to facilitate exchange of patient information. In order to provide care efficiently and effectively, we must have integrated health IT networks across clinics and hospitals. But fewer than 1/3 of hospitals had clinically integrated networks in 2013. To encourage quality improvement, policymakers should promote mechanisms that facilitate the electronic sharing of clinical records and promote new payment models to provide incentives for sharing patient records across settings. Thank you very much for your time and attention. Hope you've learned something about care coordination.